What's up, Hoopers? Did you just experience some knee pain or had a traumatic injury? We're going to go over why we like to use blood flow restriction training to help decrease knee pain. And we're going to give you guys a sample session. So we like to use blood flow restriction training to decrease knee pain because blood flow restriction training will help provide this analgesic effect through this hormonal response of decreasing blood flow to the knee. So if you want to learn more about blood flow restriction training, click this link above. It's going to go over how exactly blood flow restriction training works and all the benefits. But pretty much to give you guys a quick recap, we use this blood flow restriction training to provide a way for us to decrease arterial blood flow and also decrease the venous blood flow coming up to your body. So the way it's going to work is here we're using the Suji blood flow restriction training. This is a personal one that you can purchase. Click the link in the description. We have a special discount code if you guys are interested. But what you're going to do is you're going to use a blood pressure cuff and place it, sorry, not a blood pressure cuff, a tourniquet, but it acts like a blood pressure cuff. You'll see why. But you're going to place this as high up as you can towards your groin area. And the reason we want it as high as we can is because that's going to help decrease that arterial blood flow to your leg. So here we'll put on the strap, tighten it up, and you want it kind of snug there. Once you have it snugged, then we just place this here, and we already had the whole activation process. But what happens is normally in the activation process, we first find out what your total occlusion is. So you'll be laying down and it gets your total occlusion, and from there we choose 70% of that occlusion to be restricted. That way we're working out in that percentage blood flow. So here I'm going to turn it on. It's going to start activating here. So now that it's starting to activate, it's going to seem like a blood pressure cuff. So it's now going towards that 70% range. So what's cool about the Suji, it's all Bluetooth enabled, and it just turns on once you use it on the activation through your phone. So now that it got to that 70%, so now we're technically only having 30% of arterial blood flow going to our leg. So when you do that, one of the things that we like to use is after any kind of injury, it's kind of hard to move. So we'll start with very basic exercises. So the first exercise I like to use for an athlete that just came in, injured his knee, let's say playing basketball yesterday, is long-arc quad. So now that this cuff is activated, what I'm going to do is just simply kick out my leg and try to activate my muscle. Because normally what happens after any kind of injury is sometimes you'll have some swelling. Sometimes you'll have your quad just kind of shut off. So what we're trying to facilitate is one, activation of the quad and help your knee go through its normal range of motion. And with that knee going through that normal range of motion, we're helping actually facilitate some of that swelling process to go up and out of your body. Also, what we're allowing for our body to do is activate that quad, because a lot of times once you injure your knee, the hardest thing to get back is getting that quad activated. So the rep scheme that we like to use is a 30, 15, 15, 15. So you're gonna go 30 reps, rest for 30 seconds, go 15 reps, rest for 30 seconds, and do that 3 more times. That's our first exercise. So super basic exercise, long arc quad. But after injury, this is super important because you're working that range of motion and getting that quad working. So then we turn off the cuff. So we just deflate it for a minute or so after we do 30 seconds. After we do 30 reps, 15 reps, 15 reps, 15 reps, for a total of 75 reps. Then we go into our next exercise. Our next exercise is gonna be a bridge. So what's gonna happen is you're just gonna lay down, and now we're gonna be working more on our hamstrings, where we're just laying down, pushing up, and lifting our hips off the ground, and coming back down. Pushing up, lifting back up, down. The most important thing here is we're doing this exercise because it's going to decrease pressure in the knee. We're actually targeting more of the hips there. So when we're targeting more of the hips, less stress in the knee. So this is going to allow us to get some exercise in while we're in that knee pain stage. And normally at this exercise, from our experience, a lot of people aren't feeling anything in their knee. Also, what you can do is you can go up with 2 and then just come down with 1, offloading that right leg, but you're still getting that effect. Once we get that exercise done, like I mentioned, the 30 reps, 15 reps, 15 reps, 15 reps, the next exercise is going to be the straight leg raise. So this one's a little bit harder. So what we're going to do is just going to squeeze our quad, lift it up, then bring it back down. Relax it, Squeeze the quad, lift it up, bring it back down. One of the most important things I tell people too is we don't want us to squeeze the quad and our knee stays bent. That's what we don't want. We want our knee to be straight when we do this exercise. If it's not straight when we do this exercise, we have to regress it. And the way we're going to regress it is by just laying down and just squeezing our quad, making sure our knee's straight. So squeezing our quad, making sure our knee's straight, and that's going to help just activate, facilitate the quad and get our knee straight as well. After any kind of injury, sometimes our knee wants to stay bent, but we actually want it to get straight, or else that's going to lead to some flexion contractures over time. So squeezing the quad, and the same rep scheme applies here. So 30 reps, squeeze it for like 5 seconds, let it go. Do the same thing, squeeze it, let it go. So those are the 3 exercises we like to use for any athlete that's experiencing knee pain using blood flow restriction training. So the big benefits of blood flow restriction training, we're going to be able to strengthen the muscle without putting excessive load on the joint, and we're also going to help decrease pain due to its analgesic effect. So hopefully you like this video, guys. Hopefully it got you guys kind of in the minds of what we kind of sample a session right after someone got injured. If you like this device, like we mentioned before, click the link in our description. We have a discount code especially for you guys to get Suji Personal BFR system delivered to your house. Also, if you like the video, hit the like button, subscribe button, share this with any friends and family that are experiencing knee pain. But yeah, we are the Basketball Doctors. Let's ball for life.